Hi, everyone. This is Jonathan Damonte with episode 12 of the podcast. And this is about how to take a remedy, how to take a homeopathic remedy. Just first, as you know, I'm a trained homeopath and Bowen therapist. And in my clinical work, I always looked for the most efficient ways to prescribe remedies that actually worked for my patients. And I have brought to you 27 years of experience in this podcast series. And my goal is to make homeopathy simple, to create information that makes the complex simple and shines a path through the forest of information that we get on homeopathy. I learned about homeopathy through my father, who died when I was 12, and he was a renowned homeopath who brought homeopathy to Europe by teaching and practicing, and he's very, very renowned in Europe as being one of the people involved in the resurgence of homeopathy. And I was very, very fortunate to learn through his students, and it creates a great connection for me. So, how to take a remedy? So, first of all, what is a dose? And that's an important point in learning about homeopathy. I'm just going to move this arrow. I don't know why it's there. Anyway, it's there. A dose in the dictionary is a measured quantity of a therapeutic agent to be taken at one time. That's very befitting of a homeopathic remedy. We really want to take a dose and know what the therapeutic effects of that one dose are before deciding to dose again. And you'll see on a package of homeopathic remedies in Canada, you read 5 globules 3 times a day. And this to a homeopath is kind of a shock, because that's not how we would prescribe a remedy. So we try to use what is called a potency, which is essentially the strength of the remedy, that will stimulate a healing response with as little aggravation as possible. And an aggravation I've talked about in the podcast, What Goes Bad with Homeopathy. It's essentially too much of a good thing. It's where the body is pushed too hard by the remedy, and you start to have your symptoms aggravate. So as important as the step of choosing the remedy is, choosing how to dose it can be quite a complex question. And I've written here, in my practice, I often start with either a 30 ch, a 200 ch, a 1m, or more rarely, a 10m, single dose. And what is a single dose? For me, is either 1 globule pellet or 2. I've learned to give 2 pellets to make sure that the medicine is absorbed into the sugar ball that is the dose, that is the carrier of the dose. And it's important to understand that the higher dilutions, 200 and above, 200, 1m, which is 1,000, 10m, which is 10,000 and upward, these affect the patient's vital responses more profoundly than lower dilutions. And what does it mean, a vital response? It means the overall bodily systems, whereas a lower dilution, they're going to be both safe for sensitive patients, but also appropriate for single reasons. So, for example, when we give an arnica after our child has a bad fall and they're in a bad shape with a bruise and pain and shock, we give arnica. Or and we might give a 30C because it's very specific. It's going to work very clearly. It's not about the potency, the remedy. And the only aspect about potency is how strongly it affects the overall vitality and overall response systems that come into play when you give a remedy. And I often give a 200C in my practice because most of the patients I see come with a chronic illness. And therefore, I want to go a little stronger with the medicine. I say that, but that actually isn't perhaps true because recently I'm giving much, much weaker remedies. I often give a 30C in water to my patients. That's a very common way I prescribe now. So, it comes into a question of the availability of remedies. So if you had a first aid kit at home that you bought from Helios or another Washington homeopathics, you'd find that they're either 30 Cs or 10 or 200 Cs. And so it may come down to just having the remedy and not having the potency that you want. So there are ways to kind of attenuate that potency. And in this slide, I want to show you that image of a remedy. And on this bottle will say Apis mellifica 9C, and it'll say take 5 globules 3 times a day. And I would give, if someone needed Apis, if they had a symptom that required it, it would probably be quite acute. It would probably be very topical on their skin. And more than likely, I would want to give 1 dose and wait and see how it affected them. So it's important to remember in homeopathy that the remedy we choose is chosen because of the similar symptoms it can produce, so that we don't want to give too much of the same problem, but just enough, which is why we give it in dilution. And we want to give just enough not to cause an aggravation, but to cause an extra stimulation to the vitality and immune response, the healing response of our body. So as a homeopath, we want to avoid that. And that comes down to the strength of the person, for lack of a better word. But we call it in homeopathy vitality. How vital is their ability to respond to the medicine? And will their body be overwhelmed by that response? In other words, would it cause an aggravation? So we choose the potency that will cause as little aggravation as possible, and that's generally the lower potencies, 30C, 6C, 9C, 12C, and so on. It's important in a way not to worry about the number of granules or globules or pellets, but just give 1 or 2, ignoring the instructions on most packages. They're probably there just to satisfy government regulations or government expectations that there should be a dose written on the bottle. Allow the granule in your mouth to dissolve and take it a few minutes away from eating or drinking. And in fact, I now tell people to quietly sit with the remedy and allow it to absorb into their system. If I'm treating a very acute issue like a fever, and I'm pretty sure of the remedy, I might suggest taking 1 or 2 or 3 doses about an hour apart. But if after 1 or 2 doses you see no change, you probably have the wrong remedy. And so there's no point repeating something that doesn't work. Very important not to keep repeating a homeopathic remedy if it doesn't work. And then when deciding if you should repeat or wait, it's important to understand a simple idea about the remedy you've taken. Did it help the problem that I was hoping it would help? And has the problem returned? And should I then repeat it? Well, it's exactly like that. If you took a Tylenol for a headache, you would take it if it helps, and you won't repeat it unless it's helped previously and the symptoms have returned. So that's the obvious logic of a remedy as well. So what to look for when you've taken a remedy? So what can be a good response is having a slight aggravation lasting no more than an hour. So let's say we're treating a child who had food poisoning, a flu that caused a stomach upset as well, and they've been sickly, they've been home, they've been in bed, they've vomited earlier, they don't feel like eating. Well, we choose a remedy and we give it to them. They suddenly feel a rush of symptoms, need to vomit, and then after that, they're quite content, because sometimes once you've purged, you do feel better. And then they might go to sleep, which is another very positive sign of a remedy, having a good healing sleep. And then, of course, their symptoms improving. So what could be bad? This is aggravation that lasts longer than an hour. So let's say your child has a fever of 99 degrees. And you give a remedy and the fever seems to go up. And you've heard your homeopath say, well, it could get a little worse for a short time. But after an hour, the fever is still high. Do not repeat the remedy, but seek consultation for a second prescription choice. And usually a good homeopath will give a parent a couple of options and give them enough instructions to do that. So agitation, a high spiking fever, or even delirium are definitely signs of a remedy worsening the symptoms. And the third point, a worsening of your symptoms overall. So let's say your child had a sore throat, they're lethargic, they're complaining of lack of appetite, they've got a runny nose, and just very sickly. Excuse the dog barking. You give the remedy and then they wake up next morning coughing. Well, that's a worse symptom than a runny nose. That means that the infection has gone from the head to the chest. That's a bad sign. Definitely a sign the remedy is not helping and perhaps even made it worse. So I want to mention a methodology of taking a remedy that is very useful to know. Because sometimes we want to give a remedy more frequently, but we're concerned about aggravating, such as someone with a very active skin reaction. We might give the remedy in water and allow them to take it more often. So for instance, a client I had just a couple of weeks ago had a very, very extreme case of hives, and the itching was intolerable. So I had them take the remedy and put into half a glass of water one globule, one pellet, stir the water gently as if stirring milk into a cup of tea, and then they would take a teaspoon. And if they repeated, due to the remedy working, they would have kept the water and simply stir it again and take a teaspoon. So that's what we call plussing a remedy. It's a little different than using a stronger potency like a 200C. It's not like using a low dose like 6C. It's just changing the frequency of the remedy to be softer in its stimulus. So a bit like talking through cotton wool, a silencer for the remedy. Plussing a remedy is like a silencer for a homeopathic remedy. That's a good expression. You don't hear the loud noise from the remedy. You don't have big aggravations, and you can more safely take the remedy. So that's a little information about taking a remedy. Of course, it's a lot more complex than that. And of course, this is just a general eye-opener for different ideas about a remedy and to understand a little bit why we choose different potencies. And of course, there's so much to learn. And that brings me to the point of my course, Homeopathy Simplified. Go to it at the website below and put your name on the list to get advised of when the next class will start. So I hope you enjoyed this. I do. I enjoy these very much. And talk to you next time. Thank you.